Hey guys, Dr. Eric Smith here, and I'm back with Pretty Bow Kensi. And as I was finishing up with Pretty Bow Kensi last time, her mom goes, hey, and mentioned something about her jaw and having jaw issues. She was just at the dentist, right? Dentist said, just don't do this, right?
Yeah.
Just don't open her mouth. Yeah, right? So anyway, I get that, and a lot of times I actually work with dentists because I want to work on the TMJ. So you actually, no matter who you are, you do have TMJ. Now, whether or not you have issues, that's a whole other bag. But we have two temporomandibular joints, which is what TMJ stands for. What we have here is you have TMJD, which means temporomandibular joint dysfunction. What I do and how to test for this, for those that you want to learn at home, take your two fingers like now, and you're going to put it right here, and then you're going to slowly open your jaw. Okay, when you say where, doc, you're going to go right at that little kind of point on your ear, and then you're going to slide them off, and then as you open your jaw, and you want to go all the way, you should feel it move, okay? So the one that moves least and last is the one that's stuck. So we're going to test this with her, even though I already know which one it is. So Kensi, we open up slowly, and you can see how her jaw tracks. It goes again. So those of you that don't know, she is a rock star jiu-jitsu and is competing. So the fact that she's had probably her jaw jacked around a few times is probably more the case than her smashing large jaw breakers all the time. So she's going to have some tender points in there too. So we know from that this is a side stuck. So that's the one I'm going to treat. So I do two types of release with it. I release the lateral pterygoids and the medial pterygoids for those of you who are anatomy nerds. And I do that, the muscular part first, because is the joint dysfunctional or are the muscles pulling the joint out? And because she doesn't have any, like, no traumas, you weren't in a car accident, something broke your jaw, it's probably the muscular part. So that's what we're going to release. So I'm going to have you open your jaw all the way. One, we're going to do this 5 times. Good, close all the way, and then go open all the way. Good. Do it again. Awesome. 2 more. All the way, good. And this. Okay, cool. So she was super compliant with that, and even in the last video. This next one we're going to get into, intermedial pterygoid. This is a one for the doc because this is also a point that with most patients, whatever list of demands you have, they can probably come through and I can get, because this is going to be a little tender. But with this woman, I'm not going to mess with it too much because I'll end up on the ground in an arm bar before I know it. So we're going to be real careful with that. So what I'm going to do is you're going to slide your finger, if you want to look up on an anatomy chart, something like that, to find where that medial pterygoid is and trying to get in there and get that to release. We're going to do a pin and stretch technique. So you're going to end up closing your mouth when I tell you, and then you're going to open your mouth all the way. And I mean all the way. Okay, so we'll work through 5 of those. The last ones are going to suck. It's right next to kind of a nerve that can kind of get to the tear duct. So if you get a little more, that's what that is. But it's also not that common. The longer you've had it, typically the worse it is. So if you've been dealing with this issue, definitely go get it treated. I normally like to treat this, and then I have the dentist do the orthotic, the mouthpiece, to fix this and keep it to where it needs to be. But this is something, again, like you want to get treated on the muscular end of it first, and then get into the other one, okay? So you're gonna open your mouth slowly for me. I'm gonna come in, okay? Close, good job. And then I'm gonna pinch the muscle, and you're gonna open your mouth all the way. Open, 1, close. I want you to go all the way, no cheating. Go ahead, open, all the way, all the way, all the way. There you go, that's 2, 3 more. Okay, close. Now the next 2 are gonna suck, sorry. Go ahead, all the way, all the way, all the way, all the way. Good, 1 more. This one's gonna suck. Go ahead. Good job. I saw you hustle through that last one. Now, what we do is just retest, because sometimes you don't need to adjust it if that fixed it. So go ahead and open up slowly. Still got a little click in there. So going up slowly. Good. Open up slowly. Cool. So it got a little bit better, but not a lot better. So you'll see some improvement. I normally can fix a lot of this in like 4 to 6 visits. So now we're gonna do and use this little activator. What it's doing, instead of me manually adjusting, which I will probably end up doing, I can just focus a little bit of force on a certain area. So to make sure we're treating everything here, I'm just gonna turn her head to the side so you can see this and what I'm going on. And instead of just beating her jaw with this, because she's pretty tender through there, I'm just gonna use my thumb at first as kind of shock comes over. So open your mouth a little bit, keep it right there. Close. Open your mouth a little bit, right there. Okay, close your mouth. Open a little bit. Okay, so the next thing I'm going to do before I do a manual adjustment, I'm going to clear the upper cervicals. Because a lot of times when your upper cervicals, your C1, CO, and up there are jammed or not in the right spot, then it can sometimes move the jaw. I feel like this is more of a chronic thing on her with her sport, so it's probably what's going on. We're just gonna make sure. So the way I do an occiput adjustment here is actually this. It's gonna feel like probably a move you've done to a few other people in your sport. Let this relax for me. Good. Good. Okay, open up slowly. So this one, you're gonna open up just a little bit. Keep and just relax. Good. Open up slowly. So it's gonna take a few more adjustments, but definitely we wanna get that loosened up. So we're gonna do 5 more passes. I'm gonna do a different adjustment here. Open your mouth all the way. Good. Open up. Close. Open up. And one more. So that is a typical TMJD adjustment that we're going to work on. Some chiros do it, some don't. So if you have any questions or you have something that might be similar where it's giving you a lot of headaches or something you want to get an opinion on, definitely talk to your local chiropractor. But if it's something that you think I can answer, feel free to put a comment below. And so we follow up, and what I typically do is either cold laser or ultrasound. So we're going to take her with therapists in the next room to do a little bit of that, and then we'll continue treatment on this next time. So again, if you have any questions, let me know. Follow Pretty Bull Kensi. See the next videos, and follow her Instagram to see what shoes she's wearing and who she's tapped out recently. So we'll see you next video.